Good morning. Remember, breathe. Check for symptoms of dry cough, fever, shortness of breath. Check on your loved ones. Call your mom, call your grandparents, and check on your friends. Check on each other. It's been a long ride and we need to buckle up because it's going to be a long ride. It's going to be a lot longer. And now step back. A hot topic that everyone's been talking about is testing. What we're talking about is two basic types of testing. One is testing for the virus, that's a PCR or the swab testing. And then we have some that rather take days. You talk about instant testing or point of care testing. That's for presence or absence of active virus. The other type of testing that I want to talk about today is antibody testing. The antibody testing is testing for the two types that we're talking about: IgM, that's around in the body and the blood, that's around during active infection, and IgG, which is your memory cells. Now, the issue that comes up is when we're trying to decide what types of testing we're going to do. The tests that come out, there are some that test for general coronavirus family as a whole. If you remember way back when this started, we said that COVID-19 was part of the family of coronaviruses that include the common cold. The other one that we're talking about, the test that we're actually looking for with antibody testing, is one specific for COVID-19. What the FDA and Dr. Fauci and everyone's talking about is making sure that the tests that are used test specifically for the presence or absence of antibodies, IgG preferably, to COVID-19. What could happen if not done correctly is you can get a test that tests for general coronaviruses, and say you had the common cold and you have antibodies for coronavirus. You're still vulnerable to COVID-19 potentially because you've not been tested specifically for this virus. Antibody testing that we're talking about are the ones that test specifically for the antibodies, the IgG antibodies, to COVID-19. There'll be some that test for IgM and IgG, but we're looking specifically for tests that will let you know whether or not you've been exposed to the virus and are possibly protected and are free to go back to work or you're safe going out in the general public. That's exactly what we're looking about. Now we can have a discussion later about IgM and IgG again to remind, but again, the test that they're talking about is not for coronaviruses as a whole. These are specifically for IgG. So hopefully that clears some of it up. Remember, there's two types of tests, one for presence or absence of virus. That's the swab and the stuff that we've talked about with drive-through. And that's the one they're talking about with as far as source contacting to see whether or not someone is positive or negative and see if they've been exposed. And the other one is for antibodies. And the antibody test that we want is the one specifically for COVID-19, not just for coronaviruses. I hope this helps. Have a good day. Remember, breathe. Check, step back. We got this.